Hey, what's going on, guys? This is Dan from Fitness Pain Free. I'm a physical therapist and I help coaches and clinicians get their clients and patients out of pain and back to training in the gym, okay? In today's series, we're going over modification for the bench press when you have shoulder pain, okay? What I'd like to go over today is changing the angle of pressing, okay? So when folks have shoulder pain, it's oftentimes because they really overused a given movement, i.e. the bench press. So what ends up happening is that you're doing the same motion over and over and over again, and oftentimes certain structures within the shoulder, namely the rotator cuff, the biceps tendon, sometimes the pec, the AC joint, gets irritated. And one of the things we can do to modify the movement slightly to make the pressing motion much more tolerable so folks can continue working towards their fitness goals, right? They can also rehabilitate their injury is by changing the angle of the press, all right? So if you're using a flat bench and the flat bench is painful, one of the first things you can try is inclining, okay? So when I am doing an incline press this way, think about what happens within the shoulder. So if I'm doing a flat bench press and I'm pressing, the angle is straight ahead this way. But as soon as I go on an incline, I have to get my elbows underneath the barbell and press more an upward path, okay? And what's happening in this situation is I have to go into relative external rotation, okay? And what's interesting about the shoulder joint as well as the rotator cuff is that when you spin the joint this way, you actually move the rotator cuff with it, okay? So oftentimes when you start pressing overhead, when you have pain pressing horizontally, you might think more stress in the shoulder, that's gonna make it worse, but you actually might be offloading some of the structures that are getting overworked when you're doing flat bench, all right? So when you have pain in the bench press, you can attempt to modify the angle by doing a slight incline, okay? The other piece is you can always do more or less incline, all right? You don't necessarily have to go, super steep, but I would recommend trying what is most similar to the movement you're trying to improve, the bench press. So I wouldn't incline it really high at first. I'd incline it a little bit and see if that helps with your pain, okay? So we tried to incline the bench press, and let's say that wasn't successful. The patient is still hurting, your client is still hurting a lot. You can also try a decline, okay? So I don't have a decline bench set up, but I want to show you what's happening when you do a decline bench, right? So let's imagine I have a decline bench right here, and it hurts to do a flat bench press, like so. If I start to decline, all right, so imagine I'm on a decline now, a couple things happen. So for one, the bar is going to touch my chest sooner than if I was flat. I have to go a little bit lower, okay? So look at the angle of my shoulder deep in a bench press versus in a decline press, I don't have to go quite as deep, okay? And when you change the range of motion requirement, that might reduce some of the stress on the shoulder that's giving you pain in the first place. So it's worthwhile to give that a shot, okay? And the other piece is that we talked about a regular bench press, we have the elbow right underneath of the hand, and when we go on an incline, we have to modify that slightly, okay? The same thing happens with a decline, all right? So my shoulder angle would be here for a regular bench press, and as I go into a decline, it actually changes a little bit. So you might be in a bit more internal rotation. And for that reason, this movement might be much more tolerable than a regular bench press, okay? So I'd recommend first trying a little bit of an incline. If that feels tolerable, great, let's go with it, let's load it. If that's not feeling great, you can also try a decline and see if that helps you out a little bit, okay? So guys, this is the end of this video, but it's not the end of your learning. If you're a coach, if you're a clinician, and you're trying to troubleshoot pain and injury in the gym, I want you to click on this next video here where you can learn some more. All right, thank you very much, guys, and I'll talk to you soon.